Good day. I am presenting to you my research project entitled Effect of Early Pulmonary TB Infection Diagnosis by Gene Expert MTB Reef Assay on Treatment Outcomes in Pollsmoor Prison. Prisons across the world have been found to have a higher incidence rate and prevalence of pulmonary TB infection than the general population. Risk factors associated with this include poor nutrition, overcrowding and lack of ventilation in prison cells, HIV infection amongst prisoners, and inadequate healthcare services. Poor TB management strategies within prisons have led to the emergence of drug-resistant TB strains and HIV infection amongst inmates. Prisons thus act as a reservoir for TB and are a threat to the general population as TB spreads through the judiciary, correctional service, and visitors to the general population. Delayed TB diagnosis and treatment onset contribute to the high prevalence of infection and have been found to be strongly associated with disease severity and high morbidity amongst prisoners. Early diagnosis of TB will mean that the patient will be on treatment early before the disease becomes severe, and this would result in a more favorable treatment outcome. Thus, there is need of an urgent use of robust and rapid TB diagnostic tools to tackle the TB problem in prisons. Amongst the TB diagnostic tools used is the recently developed Gene Expert MTB Reef Assay. Gene Expert is a real-time based assay designed to detect MTB and rifampicin resistance infection with a result turnaround time of 2 hours. Studies have shown that Gene Expert outperforms spear microscopy and liquid culture media techniques like midget, as Gene Expert is more sensitive and specific and also can diagnose rifampicin resistance in 2 hours. Previous studies have been done to show if there is an association between early diagnosis using MTB Reef Assay, Gene Expert MTB Reef Assay, and successful treatment outcomes amongst prisoners in vulnerable populations. A study on non-national immigrants in Israel found no association between diagnosis delay and successful treatment outcomes in TB-infected people. A randomized controlled trial in South Africa assessing the impact of early diagnosis of TB infection by Expert MTB Reef found no difference in morbidity and cure rates between the Gene Expert arm and the control group, even though the time to treatment onset was reduced in the Gene Expert arm. Though it is thought that reduced time to diagnosis and treatment onset would result in reduced morbidity and successful treatment outcome, the studies that have been done and stated here are in contradiction to this thought. Hence, this study aims at assessing the effect of early diagnosis of TB by Gene Expert MTB Reef on treatment outcomes in a prison setting in South Africa. The hypothesis is that early detection of TB infection by Gene Expert MTB Reef Assay will result in a high successful TB cure rate amongst prisoners after treatment. The aim is to assess effectiveness of early TB detection by Gene Expert MTB Reef Assay on treatment outcomes. Our objectives are to assess treatment outcome for the patients after TB treatment and to assess the time delay from diagnosis to onset of treatment and correlate the time delay from diagnosis to onset of treatment with the treatment outcomes. The study is a retrospective cross-sectional study, and patient records will be assessed to find information on time to treatment onset from the time TB was diagnosed by Gene Expert MTB Reef and the assessment of treatment outcomes of these patients. The participants will be male and female prisoners diagnosed with pulmonary TB using GeneXpert MTB RIF assay and treated at Pollsmoor Prison, Tokai in Cape Town, South Africa between January 2014 and July 2015. Analysis of delay of diagnosis of TB and treatment onset will be done for each participant. Analysis of treatment outcomes for each patient will be done. And a correlation between treatment outcomes and the delay of diagnosis of TB and treatment onset will be done for each participant in this study. This study will be useful to the South African government and the Department of Health and the Department of Correctional Service in South Africa to aid, to give them information whether the GeneXpert is effective in combating the TB problems in prison. Thank you.